In this podcast from Chapter 3, we're going to talk about protecting yourself from disease. So we'll begin by describing 5 methods of disease transmission. Then we'll talk about stopping that disease transmission with standard precautions, BSI, and the use of PPE. The major skill in Chapter 3 is how to safely remove contaminated medical gloves. See Skill Guide 3.1. So with protecting yourself from disease, we can begin by defining what a pathogen is. It's a microorganism that can invade the body and cause disease or illness. That could be a bacteria or a virus. And when we think about disease transmission, here are the 5 key ways it can occur: direct contact, indirect contact, airborne transmission, injection, or through a vector. Let's define those. Direct contact might involve close person-to-person contact. If you think about maybe the way that STDs are transmitted, we see that person-to-person contact with bodily fluids. Indirect contact might involve your physical contact with a surface, so you can imagine stopping that disease transmission by properly using disinfectants. Airborne transmission occurs from inhaling droplets. We see now much of the public wearing masks in response to COVID-19. Ingestion, consumption of food or water contaminated with a pathogen. If you've ever backpacked, you know how important water treatment is. And vector-borne transmission is through a third organism. Think West Nile virus transmitted by mosquitoes. Now, contamination is the soiling of an object by some foreign material. And really, if an individual comes in contact with that surface and acquires enough organisms, they may become symptomatic. Now, to protect yourself from disease, we can think about those 5 modes of transmission. The first thing that we want to discuss is the CDC guidelines around standard precautions. And essentially that says treat every patient as potentially infectious. It may be a beginner skier on the bunny hill who just tweaked a knee. Doesn't matter. Approach them as if they're potentially infectious. We don't want to fall into complacency. Now, along with that, we get the idea of body substance isolation. We want to make sure that if any bodily fluids are present, blood or mucus or vomit, that we can protect ourselves from that. And we see the idea there of isolation. It is really essential that you protect yourself from any patient's bodily fluids. Now, a couple of things that we want to be careful of with that is it could be bandages or towels and blankets that we're using, or even perhaps their belongings that may be scattered around a scene. So how do we further protect ourselves? Well, we want to make sure that we're using personal protective equipment. And we see in the image here someone that's using personal protective equipment. And each one of those items is essentially a barrier between you and the patient or any of those fluids. So let's look, first of all, the most common piece of PPE are medical gloves. We always want to use nitrile or vinyl gloves. Too many people are allergic to latex. Carry several pairs in your ski patrol vest and put on a fresh pair for each patient that you work with. Eye protection should be worn during every encounter. Inside, you may have safety glasses available if you're working in a clinical setting, but outside, ski goggles or wraparound sport-type sunglasses will provide some protection as well. Surgical masks are something that we're seeing more and more of, given what we know about COVID-19. And those masks can protect the patient as well as yourself from any pathogens that you may have. As you approach a patient, if they don't have a mask, it's appropriate to ask them to put a mask on, or if you have a disposable one and can hand it to them before you begin your treatment. The final thing that we might consider is if we're working inside and have a medical gown available, outside, a lot of times we'll rely on the waterproof nature of our outdoor gear to protect us while we're patrolling. And finally, one of the most important things we can pay attention to is hand washing. Hand washing with simple soap and water for 20 seconds, as recommended by the CDC, can prevent the spread of disease. Finally, if you were to become exposed occupationally, there's some things that we can consider, and that could be dependent on local protocols, and it may be some sort of post-exposure prophylaxis response to that exposure that you've had to protect yourself. Now, the final piece of dealing with patients and properly considering how to protect yourself from disease, think about that second method that we described for disease transmission, indirect contact. So if any surfaces may have been exposed to a patient or possibly bodily fluids, we want to decontaminate those. And a lot of times that's as simple as we see now, some of the straightforward guidelines. A quarter cup of bleach in a gallon of water will disinfect surfaces from almost any pathogenic organism. In summary, don't forget the 5 ways that you can be exposed to a particular disease: direct contact, indirect contact, inhalation, ingestion, or through a vector. To protect yourself from these, think about what a mask does. Well, it could stop you from possible inhalation. Gloves can protect you from direct or indirect contact. Hand washing is also critical as a final step to protect yourself from disease transmission.